regarding the question raised by Dr. Anita, I just would like to comment on the fact that nothing is Ramban. We talk about PPH bundle. Our today's conference name is Conquer PPH by Bundle Approach, and there are many modalities of treatment, and balloon is one of the modality of treatment. Yes, that's all. Balloon tamponade is the first surgical method for the prevention of PPH after the medical management fails. And today I will show you the insertion of Bakri balloon. This is Bakri balloon, and the pack comes like this. It has a 50 cc syringe and the balloon with the channels. So this is the model of uterus, and I will show you the insertion of Bakri balloon in this model. Hello, please make it straight. So first thing is this, that this is the perineum. We have to clean the perineum. We have to do the antiseptic dressing and proper draping. And the next is that we have to put the same speculum like this to retract the perineum, and then we have to get hold of the cervix. And next is the insertion of this Bakri balloon. This is Bakri balloon. It has a bulb like this. It is made of silicone, and this is one channel for the outflow, and this is one channel for the infusion or attachment of the fluid. So with the another sponge holder, we will hold it at the tip and we will gradually introduce it like this. Now we will insert the Bakri balloon. It can be inserted either with the help of the sponge holder or with the hand directly. So here I am retracting the cervix a little bit, and now I will insert the balloon. We must take care that the lower part of the balloon is above the cervix, internal os of the cervix. Now next step is to inflate. So here we have normal saline. It is already measured. This is 500 ml. We can insert maximum 500 ml of fluid. So this is the stopcock. This is how it is closed, and this is how it is opened. And we have taken fluid, and this is a 50 cc syringe, and we will push the fluid through this. You see the balloon is being inflated. When we change the syringe, then we just lock it and hold this. Again we will take fluid, we will attach it, and we will make this channel open, and then again we will push the fluid through this. Up to maximum 500 ml we have to insert, or till the bleeding stops. We can watch for the bleeding through this channel. So this is how Bakri balloon, you see that it has taken the shape of the uterus and it uniformly enlarges and gives pressure on the walls of the uterus. So this is how it is done. Next we can attach a Euro bag with the other channel. So if there is any bleeding, it can be seen from this. And next we will just give a pull like this, and we will attach it to the thigh of the patient. And to keep the balloon in place, we will just do a vaginal packing, which is very important. So it prevents the balloon from slippage. And we have to measure the pulse, BP and vitals of the patient. And if the patient is stable and the bleeding is reduced, then this balloon tamponade is successful and we can continue with it. Now, so after packing, we will remove our instruments. And this will be pasted at the thigh of the patient, and patient's vitals will be monitored, and if the bleeding is reduced and patient's vitals are stable, we will keep this at maximum for 24 hours. But usually after 12 hours, if the patient is stable, then we can remove it gradually. So for removal, we remove 50 ml of fluid gradually at every 1 hour interval, and then we remove it. So now I am showing you how to remove the catheter. So again I will take the 50 cc syringe, I will check for the vitals of the patient, and this I will open, make it open. So first I will attach the syringe, and I will make this open, and gradually, please help me hold this. For deflating, you have to again take a 50 cc syringe, and I will attach it with this end, and I will make it open, and then I will gradually start deflating. Again I will watch for the bleeding, and I will see that there is no bleeding and patient's vitals are stable. We can keep it for 1 hour like this, then after 1 hour again we can remove 50 cc, and this is how we completely remove it. So now it is completely deflated, and we can now remove it. First we will remove the pack, and then gradually we can remove it. So this is how we use Bakri balloon. It is a very good method of prevention of bleeding PV in postpartum hemorrhage in an atonic uterus once the medical management fails and the patient is stable. Thank you. Okay. So Bakri, I am just showing you the method of insertion of Bakri balloon in cesarean section. So hello everyone, I have already demonstrated how to insert the Bakri balloon in the uterus after a vaginal delivery. Now I am showing you how to insert the Bakri balloon if we are doing a cesarean section. So this is the balloon, this is inflation channel, this is outflow channel, and this is a model of the uterus which I have made myself. Now this is representing the cesarean wound. Now I will show you how to insert this Bakri balloon in this. First, we will insert this part of the balloon in the cavity of the uterus like this. And then we will just separate this stopcock and we will keep it and we will fold it like this. Then we will insert the balloon from here. And there is an assistant on the foot and side who will take this out. Yeah. After inserting the balloon, we can close the cesarean suture, taking utmost care not to make any prick in the balloon. Balloon is still deflated. So it is very easy to take the sutures without pricking it. Now my assistant will inflate the balloon as usual, as we have shown in vaginal delivery, and this is how the balloon is put.